So my name's Cathy Jones. I'm Chief Exec of the Fatherhood Institute, and I'm so delighted to welcome you to this. This is the second in our series of quarterly Think Fathers events, and it's focused on cutting-edge fatherhood themes which link research, policy, and practice. And if you think there's anything we ought to cover in our next quarterly or the one after that, do get in touch. Get in touch with the team. There'll be some contact details on the final slide at the end of the event. So today's webinar, which is called Towards a Father Inclusive Health Service, will consist of 4 short presentations. So Laura, can you flick to the next slide, please? Lovely. So here we are. I'm introducing. So I'm going to start in a moment by introducing one of our newest campaigns, which is called Looking Out for Dad. And then we're going to hear from 2 practitioners who are undertaking really innovative and father-focused work. So Dr Joanne Nicholl, who's piloting health checks for new dads in Somerset, and Carolyn Le May, who's piloted linking father and child health records down in Suffolk. And then finally, we'll hear from our head of training, Jez Howell, who's going to talk about the Fatherhood Institute's approach to training and consultancy, focused on engaging fathers in the earliest period of fatherhood, particularly in health systems. So we'll have a short Q&A at the very end. So please save any questions until then or drop them into the chat. And as I've said, we're going to record the webinar and share after the event. So I think we could start recording now if we haven't already. Lovely. So I'm going to talk a little bit about our newest campaign, Looking Out for Dad, which is all about ensuring better health support for fathers. So next slide, please. So as we all know or should know, the transition to fatherhood is momentous, and it has really unique impacts on men. It's mind-blowing, it's impactful. Very often we don't ask men, we don't ask fathers, how is it? How was it? How was the birth? How are you adjusting? So there is this sort of wealth of untapped information about fathers' experiences of transitioning into early fatherhood and the experience of subsequent having a second or a third or a fourth baby. Each moment of new fatherhood is unique and different. And during pregnancy, fathers are particularly open to receiving new information and making changes to their health behaviours and doing other things that secure the future for their new baby. So despite our kind of advancing society and big advances in, closing down the gender pay gap and moving towards greater gender equality, fathers still often are bearing a kind of the emotional load, the sense of responsibility for breadwinning. So they might be saving money, they might be thinking about changing a job so they have more stability or they can earn more. They might be thinking about security of housing, but they're particularly thinking about, should I eat more healthily? Should I drink a little bit less? Take fewer drugs? Change my car? So they're making lots and lots of decisions that will mean that they can secure themselves and their child and the mother of their children for the future. So they're super open, they're super interested, but we really neglect them in our systems and fail to ask them often even the most critical questions about the genetic inheritance they might pass on to their children. So we're often still, the booking in, asking mothers to tell us about their partner's health, the father of their baby's health, rather than asking dads themselves. So despite this sort of growing body of evidence and a growing awareness about the important role of fathers and the unique and specific impacts they have, we still fail to address and support fatherhood, and we certainly fail to do it in a systematic way. So we are in the early stages of campaigning for this to change. Now, this is a really, really great time in history in the UK, in England, to test innovation. We've got a new government open to exploring ways to tackle bureaucracy, use new technology, shake up systems. We all know that they're obviously constrained by limits on cash, and we know that our health systems are very complex. But we also know from the experience of COVID that transformation can happen. We also happen to have a cohort of new, young Labour MPs, many of whom have quite young children and have their own really complex experiences of juggling their task of being new MPs, caring and being present with their children and looking after their own health. So the other thing I haven't talked about at all yet is fathers' own health. Are we asking fathers, how are you? How's your health? Are you getting enough exercise? Are you eating well? Are you stressed at all? How's your mental health? How did you cope with that unexpected cesarean section? Or you just had a baby with cerebral palsy. How are you feeling about that? And how are you managing? And so on. So we're calling for these three things, which have been sitting on the slide for a while. So health checks for all new dads in the first year. The other thing we know about fathers and about men is that, particularly in the kind of poorest, most socially excluded communities, men and fathers often die much younger than women do. Their health is neglected. Women are often the conduit to making sure that men go and get themselves checked out. But we really fail to care for men, and we see that in all sorts of ways. The other thing we're calling for is really good quality information for new dads. We're also trying to ensure that we're capturing fathers' details and we're matching fathers' details with that of their children. So it's really, really key that we have an understanding of the link between children's health data and those of their dads, that of their dads. Okay, let's have a look at the next slide. So let me tell you a little bit about what we're doing. So we're in the process of writing to Wes Streeting. So I was at the launch of the forthcoming men's health strategy in December. And there were about 30 organisations there, all focused on men and men's health. What really, really struck me about that event was that I was the only person there and the only and one of very few women there talking about fatherhood. So we still really fail to talk about fatherhood and to address men's fatherhood and their health, and we need to. Even though there were some very, very, very powerful accounts at that event from people like Wes himself of his own fatherhood, accounts of being a child, an impoverished child in a sort of problematic system, but we still fail to engage with and talk to and think about fathers. And we're pushing for that to be different. So please join us and help to support that process of transformation, because over the next year there will be a big process of transformation, writing again to Wes and collecting people to support this campaign. The other thing we wanted to do, let's have a quick look at the next slide, Laura, is just tell you what we've been doing in this very, very tiny, statistically insignificant survey that we've been testing. We're just at the early stages of testing out what do people think, and the people we've been talking to are our friends. They are fatherhood champions, people who support the initiative. We wanted to show you this and tell you this is where we're starting. And what we hope to do is gather much more support, information and backing for our campaign. So let's have another look at this tiny survey. And as I say, it's statistically insignificant, horrifically unrepresentative, but it gives you a feel for what we're trying to capture. And we'd love you to help us by asking more people to complete our survey. If you scan the QR code at the end of this webinar, you will see there are opportunities to join the survey, to participate, and to sign up to our campaign. But what really, really is striking, I think, about the questions that we asked practitioners is some of the issues that impede the advancement of engaging with supporting paternal health. And there are three things there. So commissioning is the massive one. So very often when we are training health professionals, we're training midwives, what we find is we're helping people to explore innovation, but they are hugely constrained by commissioning bodies, people who are a more senior level in a system who haven't given them enough capacity or time in their roles to engage in a more granularly detailed or complex way with fathers. So there's lots to explore around commissioning. Lack of funding, huge theme, familiar to all of us, and still this kind of embedded focus on mothers. We continue to focus on mothers and fail to see the impact that fathers have. And by doing this focus on mothers, we disproportionately we place a disproportionate burden on men. Okay, so let's have a look at the next slide. Okay, so what's really striking about this is, there's a big body in this, again, I keep stressing, tiny sample. There is a desire to ensure that all fathers can have health checks, and also that there's guidance to support that. And we were having a chat with some colleagues at the Department for Education yesterday and saying, without targets, without measures, without ensuring that practitioners right across all their systems are being expected through guidance and through measuring the impact they have, then this work often doesn't happen. So that's really, really crucial. But this is also a critical opportunity to engage with men about their health and well-being of children and of mothers, and setting men on a pathway towards really good quality support for health throughout their lifetime. Okay, so at this point, I'm going to hand over to our first speaker, Joanne Nicholl. And Joanne is a GP with a special focus on safeguarding in Somerset. You might want to say a little bit more than that about yourself, Joanne, but we're really, really delighted to have you here and grateful for your contribution. So handing over to you now. Thank you.
Thanks, Kathy. Yeah, as you said, I'm a GP by background, but my main role is as the designated doctor for safeguarding children. So I really came at this from a safeguarding focus initially, but with that background of general practice, kind of thinking whole family approach, really. So I'm going to tell you about a project that I've been running in Somerset. So let me just get my slides up so you can have a look at those. So hopefully you can see that. Is that okay? I'm not hearing any negatives, so I'll assume that you can see the slides. Fantastic, thank you. This is something that we've called the New Dad Supporters, because it is about support rather than just a purely medical focus, but it aligns very much with what Kathy's just been talking about and the Fatherhood Institute are trying to do. I wasn't aware of the Fatherhood Institute's new proposal when I designed this, but I think actually if we'd got together we'd found we were talking about pretty much the same thing. Let's try and why do we need to give dads additional support? Well, Kathy's already mentioned some of the reasons, but a lot of the research has shown us that we don't effectively or engage or support men when they become fathers, and we just leave them feeling sidelined, unimportant, patronised, ignored, and that's really not very helpful. And as I said, I come at this from a safeguarding perspective. So what I'm seeing is that there are too many cases where men sadly cause harm to particularly young children. If you look at things like abusive head trauma, which is what used to be called shaken babies, 70% of that is caused by a male carer. That's not good numbers. But we also know that many of the men who are caught up in these horrible incidents with children have a history of trauma themselves. They often have poor childhood experiences and abuse. Many have ADHD, many have anger issues, anxiety, depression, substance misuse. And so you can understand how, with all that going on for them, they would struggle to meet the demands of a new baby. And what this project is about is identifying and addressing those unmet needs. And there's really good evidence that actually having an engaged father makes a happy, healthy families. You know, everybody does better. There's really, really good evidence that it improves the child's outlook as well as mum and dad's. So, you know, why wouldn't we be doing this, and why aren't we doing it already? I'm a firm believer in looking at safeguarding in a proactive sense, rather than kind of blaming people for harming children, and you know, that looking for reasons why people harm children and understanding that is really important, and that doesn't excuse the behavior. But I think we need to get upstream of it, and I think this quote from Desmond Tutu puts it more succinctly than I could, where, you know, there comes a point where we need to stop pulling people out the river and go upstream and find out where they're falling in. And again, that's what this project is about. It's about identifying unmet needs and getting in that early help, so I don't then see them reflected in the awful statistics of children who came to harm, or fathers who, you know, committed suicide, or, you know, fathers who were, you know, addicted to drugs and alcohol and struggling with their mental health. It's about getting in upstream of the problem. So this plan for Somerset it's a universal offer, so any man that wants it can have it, but we are focusing more on signposting men who we already know have vulnerabilities into the service. We want to ensure that fathers have specific tailored support, and we're using a kind of motivational interviewing technique. So rather than just focusing on the health aspect, it's about how are you feeling and what do you want to change, and letting them very much lead the conversation. We're trying to find those unmet needs and address them early with the right support so that families thrive. And we do that through signposting to other resources, and that might be to the GP because they need something for their health. It might be to a mental health resource. It might be children's social care. It might be citizens advice for help with their finances, any of that. And also making warm introductions, and by that I mean, you know, kind of almost holding their hand and getting them engaged with that new service. You know, come and meet my friend John, who works in mental health down the road. He, you know, maybe you'd like to come to his group and see if he can help you. We're also providing new fathers with the tools to safely care for their new baby, and again that aligns very much with what the Fatherhood Institute are doing. So we're doing some specific work on things like bonding with your child. ICON, which if you've not come across it, ICON is a national programme to help parents cope with babies that are crying, with the aim of preventing shaking babies or abusive head trauma, and also safe sleep. So those three elements come into the conversation. We would like to reduce the risk of non-accidental injury to young babies who we know are very vulnerable. That is a stream in this, but the main focus is on what do you want to change, what do you need help with? And we're using health coaches to do this. Health coaches are not medically trained, but they are trained in motivational interviewing. They work alongside GP practices, and they have a bit more time. They're more cost effective than GPs, and they have that wider focus, so not just on medical needs. And they just sit down and have a chat and say, how is it for you? What do you need? And by using them, we're not putting pressure on an already overstretched GP appointment system. So I'm just going to tell you briefly about a couple of the cases that we've had go through this programme that really illustrate what it is we're trying to do. The names have been changed to protect the identity of the individuals. So the first one is about Mark, who is a chap who's had poor mental health after a really difficult childhood, and he uses drugs and alcohol to manage his symptoms. And there are several agencies already involved with the family, and he is getting a bit of help with his mental health, but he hasn't really addressed his substance misuse. And he came in and had a chat with our health coach, and he said, you know what, I'm worried about my drug taking and the effect it's going to have on my baby. So, you know, they chatted, and he was signposted to the Drug and Alcohol Service, talked through and supported to make himself a referral. They talked about Safe Sleep and Icon, and also the other support services that were available for men in the community. And he just found it really helpful to have a one-to-one time just for him. And he's actually continued seeing that health coach for mental health and well-being support, as well as engaging with a mental health program that sits alongside this. So he found that really helpful. And then the second one is a chap called Stephen, who is not somebody you would necessarily anticipate as having any problems. He's kind of middle class, employed, sensible chap with no particular health problems in his history. But his wife had a really difficult labour, and that ended in an emergency cesarean, and she was quite unwell afterwards, and Stephen had to care for her and the baby, as well as dealing with the fear of what he'd just experienced. And he became quite tearful talking to the health coach, because that was the first time anybody had really asked him how he felt about it and what had happened from his point of view. He expressed that he was worried about not bonding with his baby and about the impact of all this on his relationship and his work. And he really felt that having that safe space to talk just helped him to make sense of it. The health coach supported him to contact the midwife to do a debrief of the labour, so he could kind of make sense and understand what happened, and also signposted into some dads groups where he could go along, and that would help with bonding. And he felt that's all he needed. You know, it was a kind of one-off intervention for Stephen, and unlike the previous case where the health coach had taken on and you know, continued to provide support. So it doesn't always need to be it can be a one-off, or it can be a multiple appointment thing. And we don't put any restrictions on that. It's what the father needs. So it's early days. We've currently trained 40 people across Somerset, which accounts to about 40% of GP practices. We've got 10 of our 12 primary care networks engaged with the programme, and we're still working on it. I'm currently having a conversation with the local naval base about doing some training to their medical staff. And we've got a logo, the New Dad Supporter, and we're starting to advertise it, and really hoping that it will build up a head of steam. And the offer of training remains open for anyone that wants it. So I think we're going to do questions at the end. Is that right, Kathy?
Yes, it is. That's
okay.
That's right. Yes. So save them up, everybody.
Okay, right. Thank you. I'll stop sharing.
Thank you so much. That was fascinating and inspiring, and very happy that it kind of chimed with some of the things that I picked up on in my introduction. You know, I feel like that you're hitting all those crucial themes, and that sense of asking questions about how are you, and some of the men you spoke to never having had the opportunity to share how they were feeling. Thank you, Joanne. I'm sure people will have questions. Please put them in the chat, or you can just speak when we get to the Q&A section, but that's not quite yet. So I'm going to hand over now Carolyn Le May, who's going to talk about another piece of really innovative work, linking father-child health data. And Carolyn is based down in Suffolk. Over to you, Carolyn. Thank you.
Thank you, Kathy. Can you just remind me, Kathy, how long?
You have, I can't remember, 10 minutes, I think. We'll wave at you. Somebody will wave at you. It may not be me.
That's fine. Thank you. I just wanted to.
It's 15, so 12:40, please. Thank you.
Lovely. Thank you. Okay, thank you, everyone. So I'm here with my colleague Stacey. I'll introduce myself first of all. My name is Carolyn Le May. I'm a clinical quality and assurance lead nurse, sitting in a 0 to 19 community health services within the local authority. Stacey.
I'm Stacey Farrow. I also work with Carolyn as a clinical quality and assurance lead, but previously I was a family nurse in the family nurse partnership team, so worked a lot alongside fathers and obviously their partners quite intensively when they first had their children.
Thank you. So Stacey is more recently in our clinical governance team. And so I've got a little bit of the history of where we've come from and where we're going to. But this section is specifically about the opening of fathers' records as part of delivering the Healthy Child programme. So I'm just going to share my screen with you, so I hope you can see that. Just to give you a bit of an overview of where we started with this, that was actually in 2022, when we decided that from the evidence that we were seeing and also an experience that we had of an incident occurring, that we understood that we had not appreciated the challenges for the father in the family, and had we done so, then actually that may have affected the outcomes for that particular incident, and there were particular pressures that Dad had around his mental health. And the evidence is telling us that actually, as has already been mentioned in the previous two discussions, that we do have a journey to go on to increase the level of inclusivity within health services. So what we decided that we were going to do was focus on a project that would help change the culture within our service. And we questioned what might be a way of doing that. And culture is obviously where attitudes and behaviours align. And we knew that we needed to actually have a solid action for our service to make a transition. So we did actually contact staff, and we did speak to staff about proposed changes. And this particular change was one that they were very keen for. Aside from the actual process of opening a record, what we are promoting as part of the process of doing that is that the father is included in the conversations. And we know that often fathers will say, I'll leave you to it, or I'll go and put the kettle on, or other reasons. And actually what we are actively trying to encourage with this process is that we say to dads, please stay, because actually we need to speak to you as well. You are obviously part of this family, with what we have said with the Think Family approach. So really, just to give you a bit of background in 2022 as to the measures that we took to introduce this process, in case anybody is not doing it already or thinking about doing it. We did actually do some scoping across the country. There were other areas already doing this, and we looked at different ways that other areas were engaging with fathers' health records as part of delivering the Healthy Child programme. And what we found was that we decided, because of limitations around our electronic record keeping system, that we would go with a specific model that had a limitation on the amount of time that records would be open for. But we also wanted to make sure that we did this in a way that we were managing people's data correctly, and we were considering the terminology we were using. So as part of that, we completed a data protection impact assessment, regarding the data storage and how we manage the processes of the data, but we also completed a quality impact assessment and took that into our local authority, the Quality Impact Assessment Committee, and they reviewed the terminology that we were using and the processes that we had. We actually had 2 teams that were piloting. So as Stacey has mentioned, Stacey worked in the, one of the teams that was engaging in the pilot, and then we had another team that was in an area where we know that there are higher levels of indices of deprivation, and that was another area that we completed the trial in. We did find that clinicians engaged with the process and that we had very good feedback, both from clinicians and from fathers that had engaged. And we really did make a particular point of capturing fathers' feedback to understand how they felt about being included on both being added in the groups and relationships on the child's record, and then actually having their own record open as part of that family unit on our electronic record keeping system. We did identify early on that there were limitations that were administrative within the pilot, and I will talk a little bit more about that as we go on. When we were actually coming towards the end of this pilot, we had some project funding available within our organisation, and we put in a bid and secured some money for training for staff around engaging fathers, and that was run by Fatherhood Institute with Jez completing that. We had 3 sessions. One was for the health visitors, 0 to 5, a bespoke session for them, one that was based around safeguarding that was for 0 to 19 practitioners, and then one for our family nurse partnership team that was bespoke to them. They were very informative and really well received, and we felt really enhanced the process around the transition we were making. And of course there were limitations on when people could attend. So the other thing that we did as part of the pilot, and also then subsequently within the evaluation, was ensure that we triangulated information around learning from safeguarding practice reviews, from incidents that were occurring, and also quality assuring through record keeping audits. So the challenges that we've had, as I've mentioned, are administrative hurdles. We have also, and that is mainly around practitioners' time, and I will come in a minute just to talk about how we have developed that. We had to ensure that in accordance with GDPR, we followed a privacy by design approach, and that really has been developed by introducing the policy that we have, and Stacey wrote the policy based on information from other documents, but the policy also incorporated co-parents and also some elements of it that apply to other services within our community health services, as we have got quite a diverse group of providers within our service. So one of the challenges was around limitations on time for record keeping. So we have we use System 1 within our area, and Stacey supported the work on the development of a template, and the template enables staff to record by the use of presets. So there is a list here of presets available, And this means that you can access a father's record and you can complete the template, but you can use the presets in terms of time. We have gone with a process in accordance with our privacy by design, where we will only open a father's record when the father is present at either the antenatal or the new birth contact. And we have had a conversation with him about how we maintain our records. We understand that as part of using System 1, we have to give people enough information to opt out of information sharing, but the use of System 1 is our industry norm. So we don't actually have to get consent. It's implied consent within that system. So that is the process that we undertake. And we have on our website that we signpost parents to a privacy notice that explains our use of System 1. We do, of course, we do, of course, respect fathers' wishes. And if we had a father who decided that he did not want us to open his record at this moment in time, we certainly would comply with that, and we wouldn't open that against his wishes. But of course, we are mindful around how we manage those conversations. So the outcome from the pilot that we first had, as I mentioned before, was the feedback was very good. But actually, one of the actions coming out of the pilot was that the family nurse partnership team found the process so beneficial that they got an agreement from the head of service for a continuation of that process. So the family nurse partnership teams have continued to open fathers' records on a universal basis since we did the pilot in 2022. We did an evaluation of the pilot. We did have some delays in rolling the process out that were mainly administrative, but actually we have now launched a process as of September last year, where we have a core offer within our service that every father that we see, we will have a conversation with them about opening fathers' records. And our plans for the future within this process, along with the auditing that we're doing, is that we're very aware that the Office of Health Improvement and Disparities encourages the assessment of paternal mental health and well-being, as well as maternal mental health and well-being, and that throughout that document, parental support is the theme within that. So we are aligning to that. We're aligning to the evidence and the research that drives this change forward.
Carolyn, thank you. A very, very very fascinating, really interesting to hear about the complexity that you've had to kind of tangle with, and the deft way you've managed to maneuver yourself around very, again, complex health systems and complex bureaucracy. Really fascinating. I'm sure there are going to be loads of questions, but thank you so much.
Thank you.
Okay, yeah. So our final speaker is my colleague Jez Howell. She's our head of training. She's hugely expert and develops, designs, trains people at all sorts of different levels within health and other systems, you know, from commissioners and system leaders to practitioners. And she also manages and oversees the work of our team of training associates. It's a big team now. So over to Jez to talk about our approach to training and consultancy focused on early phase of fatherhood and within health.
Thank you so much, and thank you to Carolyn and Joanne for just inspiring presentations. I just love it. So I've got the wonderful job of talking about excellent fatherhood champions, specifically the ones who sit within the health services. So fatherhood champions are practitioners, managers who go through our unique training course and are equipped with the knowledge and skills to cascade that learning to their colleagues and their service, and really lead on key issues within the service, but also within the locality. They often develop a comprehensive strategy for building and sustaining and promoting and advocating for a father inclusive service. So anyone within the service can be a champion. They don't need prior experience, and they don't need to be in a management role. And many champions become passionate advocates and continue this work for many years. And in fact, I did this course in 2000, so 25 years ago now. We currently have between 160 and 180 champions across 10 local authorities from all sectors, including maternity services, health visiting, infant feeding, early years, social care, education, libraries, youth services, probation, teen pregnancy, and many, many more. The list is growing weekly. So our 3-day training is nothing short of intensive and transformative. We throw participants into a lake of evidence, case studies, and deep exploration of this subject. They dive into topics like unconscious bias, explicit exclusion, fatherhood and intersectionality, and the research evidence that underpins all of this. And together we unpick what father inclusive practice could look like in their own unique contexts. Throughout the training, participants receive a lot of support as they work on creating a portfolio of work, and that often includes using the audit tools to assess their own service. They're required to present their findings to the group, and these presentations are as diverse as the champions themselves. Some will take a really clinical approach, using quality assurance to identify gaps. Others bring creativity, using art and drama or poetry to delve into and express the realities of fatherhood. Every single contribution is deeply thoughtful and impactful. But the journey doesn't end there. It's not a kind of training course that you can shelve. After all of this investment and commitment, champions are tasked with figuring out how they can have the greatest impact within their service. Some choose to work on a small scale, becoming the flag waver for fatherhood within their team. Others go really big, forming multi-agency task groups across the local authority and leading on system-wide change. Ultimately, each champion defines for themselves what being a champion means to them and how they can make a difference. I have the pleasure of meeting many of these champions through the training and beyond. We're in touch with them for many years later, some of them. And some of the commonalities that come through in the conversations with people working within health services, I'm just going to quickly go through now. The first one is, can we do that though? It's a question we often hear. The answer is usually tied to guidance and policies, and rightly so. These often keep people safe. But sometimes practices in services aren't just about the guidance itself. They're shaped by the culture of the service, or sometimes someone's interpretation. Another recurring issue is information sharing. For example, maternity bookings often gather detailed information about fathers, so that information is collected and stored. But when the birth notification reaches health visiting, even the father's name often doesn't come through. That information is somewhere in the system, in the ethers, but it's not shared where it's most needed, meaning health visitors then have to start that questioning again, and dad, what's dad's name, all of that, when it exists out there. Some services, as we've heard, don't open records for fathers, even when they're deeply involved with the family. And when we dig into why, the reasons are often unclear. This is where the role of the champion becomes invaluable. Champions question these practices, highlight the implications, and can promote a deeper level of thinking about this. Resources for fathers are often scarce. Many services rely on external tools, like the Brilliant Dad Pad, for example, but localised resources or even materials that mention fathers are often scarce. Champions, such as some of the brilliant infant feeding leads we've trained, often find really creative ways around this and will develop resources tailored to local fathers. And assessment and evaluation of father inclusive work are often overlooked. One standout example for me involved a marvellous perinatal mental health lead who proudly introduced a pathway for fathers when mothers were referred to the service. When she returned to present her findings on day 3, she herself had been shocked to find that no fathers, 0 fathers, had accessed the pathway. By analysing the data, she'd identified gaps, that fathers weren't being told about the offer, or they didn't understand how it applied to them, or that mothers were being asked if fathers would take it up without directly asking fathers themselves. This highlighted a critical point. Pathways and services are only effective if they're tested, monitored, and adapted to resonate with fathers. This is where the role of the champion can be transformative for a service. They bring hyper-localised insights from within the service. They raise issues and they ask the critical questions, and everything is grounded in evidence. Champions bridge the gap. We can't be everywhere all the time. As much as I would love to, I can't sit in every service putting my hand up and saying, have you thought about? So we train champions to bridge that gap, and they are making an incredible impact on improving family services. Champions can shift practice and systems, so I've pulled out a few examples here of some of the work they're doing. The list is ever increasing. I couldn't go through it all, so just the last conversations I've had with some health champions. So it can be about the system itself, but it can also be about supporting the team through things like developing a formal supervision discussion tool, or casework reflections. And things like that can then lead to other outcomes, like perinatal referrals now have dad's details on. Just slight shifts in the data we collect on fathers can have a huge impact. And it is more than systems. Systems are there to support us to create relationships. This poignant poem by Nick Gwynn, a fatherhood champion in Islington and a father, beautifully captures the experiences of fathers navigating the joys and challenges of parenthood. This is in the shadow of the pandemic, and it paints a vivid picture of a father's journey from waiting anxiously in a car park to being excluded from key moments of care, and then eventually feeling truly seen and valued by supportive professionals. This poem highlights the importance of including fathers in the circle of care and recognising their love and concerns and contributions. It reminds us of the profound impact that meaningful inclusion can have, not just on fathers, but the family as a whole. It's a call to action for all of us. I'm not going to read it all. I will tell you, when Nick read it out on day 3 of the training, there wasn't a dry eye in the house. Let's hope I can get through it
in one piece. So I'll just read the final 2 paragraphs. The health visitors visit a room left behind, no questions for the dad, a worry undefined. Why are dads not included in the circle of care? Their hearts beat with concern, their love always there. With the second child, a different scene, appointments attended, a dad's present seen. Health visitors engaging, questions asked with care, a dad included in the love they share. She helps make the tea, explains the need for space, yet asks about your well-being, a warm embrace. Feeling included, cared for, a part of the team. In those moments, a dad's heart gleams. Those professionals who cared, their faces clear. What they wore, the car they drove, memories dear. But those who overlooked, their faces fade in the shadows of moments where care was delayed. And I think that's plenty from me. Please do get in touch if you'd like to discuss the champions training or anything else around workforce development. Please do get in touch. I'm always open for a conversation. Thank you.
Cheers, thank you so much. That was very, very powerful, and it was lovely watching some applause and some hearts and so on. Love, it's very powerful, isn't it? That sense of love and connection that's so crucial. It's not just about dry systems, is it? It's about human connection. Thank you very much. So we have